Hi, and welcome to this installment of Frank and Mary here on Nantucket. If you haven't seen this show before, my name is Art Bergeron. My day job is I work as an elder law attorney at Myrick O'Connell, but this is not about elder law. It's about my friends Frank and Mary. If you've seen my presentations at the Salt Marsh, you know that Frank and Mary, they have a very simple goal in life. They want to live in their house until they die and be buried in the backyard. If that's on Nantucket, they want to be right here. They definitely don't want to move to Martha's Vineyard. They don't want to move to the rest of America because it's a mess. They want to stay on Nantucket. So the point of the show is to help you, if you identify with Frank and Mary, by letting you know the people you need to know about and the programs that you need to know about to help you stay right here in Nantucket. This show happens to be an extremely timely one. Fortunately, because my co-host, Allison Forsgren, whom seems like everybody knows from Nantucket, finds these great guests, but she was able to get this wonderful guest for us today, who is new to the government of the town of Nantucket, but playing a crucial role here. So Allison, whom do we have today?
I would like to introduce the new Director of Human Services here in Nantucket. We love Taylor Hilst in that job. She has moved on to other things, but I'd like to introduce Jerico Mele, who is the brand new Health and Services Director.
Yeah, I'm the new Human Services Director for the town of Nantucket. I've been on this job for, I think, a month and about 3 or 4 days, and it's been a very interesting start, I will say that.
I bet it has. So as Allison was mentioning before we started the show, one of my jobs is to kind of ask people who are the guests kind of how they got here, because most people who are guests came from somewhere else, right? And I heard that you actually came from Japan. So how did you come to end up here in what you're doing right now?
I was actually originally born here, so I didn't really have a whole lot of choice on where I showed up. But no, I was born here in 1980. I graduated from high school here in 98, I believe. And I've been living here sometimes. I've been all around the world. I think I did the math, and I had been in Japan for about 10 of the last 20 years. Most recently was a 6-year stint as initially a public high school teacher, teaching English. And then I kind of branched out into doing some tourism stuff, did a bunch of public outreach things. And then I think I just got here right as there was a position opening up for this one, and the town thought I looked pretty good.
Well, that's great. That's an exciting way to be kind of coming in at the middle of a hectic time. And thanks very much for doing this. We were talking earlier, there's probably no better guest to be having right now than you, really, to be helping people, every Frank and Mary who is out there, trying to figure out how to deal with the next several months.
Yeah, it's going to be a chaotic several months, that's for sure. But there is definitely a light at the end of the tunnel that is not an oncoming train now. So that's a very good thing.
Yes, Jericho, thank you for coming on. As you may or may not know, our show talks to people in the senior citizen arena and their families. And there are a lot of questions about who gets what, when, and where, and how. And I don't know if there's something that you'd like to start off with beforehand, or if we should just start asking you questions. What is your preference?
Well, I've got a couple of things I'd like to share, at least initially, about how the vaccine situation is evolving, specifically with respect to the elderly. So the federal government and then the state government, which is following along their general guidelines, has set up a vaccination regime, I guess is what you put it as. It starts as a phase 1, phase 2, phase 3 kind of thing. Phase 1 is what we're in right now. It started as soon as the vaccine was approved for human use, and will probably continue until February. Phase 1 is dealing with the extremely short supplies of vaccine by prioritizing, first responders, people in assisted living communities. On the island, most of that vaccination is taking place in-house. So, for example, the hospital did their own vaccinations. OIH, I believe, is doing their own vaccinations. The various EMTs, police, fire, they're doing their own vaccinations. And then the Department of Health will be getting people who qualify for phase one, their vaccinations. And as that's where we are right now, that's a very limited pool, but we do have a sign-up sheet for that phase one vaccination on the town webpage. The easiest way to find it is to just Google Town of Nantucket COVID vaccine. It should be the first Google response there. Then the phase one goes from now basically until February. Vaccine supply should increase. And at that point, phase two is where people who have various medical conditions that may make COVID especially dangerous for them, for people over the age of 65, teachers, health department workers, DPW, anyone with diabetes, COPD, any of those things. That sign-up process is going to be starting in the next week or so. Actually, so it should be the next couple of days, actually, and will continue from February through to end of March, most likely. And then phase three is going to be the general, everybody gets a vaccination. So probably for your viewers, phase two is the most significant stage. And that's when they're going to be they're going to be filling out a form online or a variety of other sort of gap spots that we've set up to handle people who do not have access to the internet. And then once we collate that information, we're going to prioritize based on a couple of criteria so that we get the vaccines to the people who need them the most, the quickest. And once they sign up, we'll prioritize the names, we'll reach out to people, we'll schedule the various, depending on the number of vaccines we get, it might be a clinic, it might be a by appointment process. And then once that's completed, probably towards the end of March, early April, assuming supply chains stay nice and straight, that will continue on until most likely the April-ish, according to the timeline. And then when that happens, that should have pretty much everyone over the age of 65 qualifies for phase two. So that's when the majority of your viewers are going to be getting their vaccines as part of the phase two process. And then phase three, because it's a little out there in terms of time, I don't have any concrete details on that.
So, if you aren't an essential worker, you shouldn't fill out the form that's available right now on the town website.
So I'm going to start sharing my screen here so that we get a good look at the actual graphic that the state has produced for us. And if you look here, we've got phase one, phase two, phase three. We're currently in phase one. So for example, OIH, which just got vaccinated, their long-term care facilities, rest homes, assisted living facilities. So phase one, clinical, non-clinical healthcare workers, that's the hospital, more or less. Long-term care facilities, OIH, I think Sherburne Common Assisted Living also falls under there. First responders, EMT, police, fire, congregate care settings, home-based healthcare workers, and healthcare workers doing non-COVID facing care. So that's basically where we are right now. It's a small pool. It's primarily administered by the organizations that those people work for. And then we'll be covering the people who don't fall into those other groups. But right now that applies to a very specific subgroup of people. So if you're waiting to get into the line for this, then this is probably not your line. In the next day or two, we'll be opening up a sign-up sheet on that webpage that I mentioned earlier, and I'm sure I'll give you guys to share as well. This phase two section here. So these are the priority rankings for phase two. So individuals with 2+ comorbidities, essentially 2 or more medical conditions that make them more likely to die from COVID, or those above 75 in age, will be taking their names and their contact information and a couple of other points of information that will allow us to prioritize inside of phase two. Then early education, K to 12, basically infrastructure workers, people whose, if they got COVID and they were sick, it would impact government functions or can impact education, etc. Then everyone over 65, and I'm going to assume this is a significant number of your viewers here, and then individuals with one comorbidity, so people with one factor that predisposes them to have a severe reaction from COVID. So in the next couple of days, you guys are going to have a sign-up sheet available to the public, and that sign-up sheet is going to take your information. We're going to put it all into a big database, prioritize it, and then when we get vaccine in, we'll be reaching out to the people who in the order of need, and then setting up either clinics or by appointment vaccinations.
So I've got a question.
Mhm.
If you're in phase one, you probably don't need to be in touch with anybody. For instance, if you live at the homestead, which, you know, someone will have reached out to you and have already been to your residence to vaccinate you. So are those places registered with the state as, you know, no one is being missed that are in that group that you know of, right?
No, and we have the sign-up sheet. If you believe that you're in phase one, that is, if you're in one of those occupational classes that qualifies you for phase one, then you can absolutely go to the town webpage, the one that I gave you the Google term for earlier, and you can sign up to make sure that we don't miss anybody. But anyone in an organized assisted living center or something like that, this has been sorted out for them. Staff and residents will be taken care of by that organization. And then anyone who's in that gap is encouraged to sign up on the town webpage.
Great. And so home health aides would be in the second phase?
Most likely home health aides are going to fall into that second phase. There are guidelines on the form that you fill out. If you fit into one of those categories, or if you're wondering if you fit into one of those categories, you should definitely take a peek at that webpage and see if you qualify as one of the categories that will receive the phase one doses.
And so, like, if you work and are working with the frail elder who's not in a congregate setting, you can just apply and perhaps get the vaccine.
Yes.
Okay.
Most likely, if it's a professional capacity that falls into one of those categories from the phase one, then yes. When in doubt, sign up, and then we'll sort you out if necessary. Again, only if you qualify for phase one, or you strongly think that you qualify for phase one.
Okay, great.
Mostly though, phase one is an intentionally small category because both of the demand issues, the supply is much smaller than demand, and also as part of the slow rollout process for the vaccine, they want to give it some time to see if there's anything unforeseen that happens. So they give it to a small number of people initially, and then they'll gradually widen the pool to, once they have a better understanding of the vaccine's operation. One thing that complicates this is that we don't have a schedule of when vaccine is made available to the town until relatively shortly before it arrives. Basically, the federal government is taking delivery of the vaccine from the manufacturer. They are then giving it to the state. The state is then distributing it based on a combination of population and regional breakdown. And so when we get a shipment, we get a notice of it, and then depending on how many doses we have, that's how many people we will be able to contact to set up vaccination for. That number should be increasing pretty rapidly in the next few weeks, specifically end of January, beginning of February, as phase two begins. That's when we should be getting a much larger batches of vaccine and be doing larger vaccination processes than the very relatively small ones we're doing now.
May I ask a question? First, I think this is terrific. I think one of the questions that this really answers is, is everybody going to be kind of like crowding around trying to get an appointment? And what you're saying is you really just want to get everybody signed up, so that you want to know your entire kind of data pool in each one of these categories, and then you can figure it out, and then you're going to reach out to people. So once people have signed up within that data pool, they kind of don't have to worry anymore. They just have to wait for the call or for the email or whatever, in order for them to know kind of, and you're going to tell them, here's where you go, right? So you don't have to figure out, is it a pharmacy? Is it the hospital? Is it something? You're going to do that all for them. And
exactly.
that's terrific. Now, I guess I had a couple of questions though, but so really but my Frank and Mary's, when I think of Frank and Mary, they're typically over 65, right? So really, they include two chunks of this phase 2 population, the over 75s who are at the beginning of the phase 2. And then when they're done, then the school teachers and a bunch of other people get it. And then the 65 to 75s then get it, right? So,
Yes.
so this initial sign up that you're doing, would this be for only those folks who are 75 and older, even though they're part of phase 2 because they're in that initial, tranche of phase 2? Or would they be for everybody who is 65 or older? And then when you get their information, you put them into the right category?
So the phase that we're taking signups for immediately, as if you went to the website right at this very moment and you signed up, that's going to be phase 1. That's only assisted living facilities and first responders. The phase 2 sign up sheet that should be up in the next couple of days, that is going to be everyone who qualifies, whether you're at the very top of phase 1's list or phase 2's list, apologies, and the very bottom. We're going to get all of those names and all of those candidates into a large pool. And then we have several different sorting algorithms that we're going to run through those names. And then we'll reach out to the people based on, so if we get, the first phase 2 shipment arrives, we have 100 doses. The first 100 people on that list will be contacted. The town had a very elaborate vaccination plan that was actually written up during the Obama years under the auspices of the Department of Homeland Security. So we have this massive several 100-page plan on how to organize, how to run all these out, all of the various metrics on how many people are going to go through, where we're going to do it. And we're adapting that to COVID right now. So once we have the numbers and once we have the vaccine supply and once we have the names, we can just go right ahead on this vaccination plan. There are provisions for the people who have mobility issues, transportation is handled. We're looking at a couple of different sites on the island if we're going to do mass scale vaccinations initially. We have the capacity to scale it up. So if we got a huge batch of doses, we could handle that. We can both store them, we can administer them. We have sufficient manpower to do the vaccinations themselves, to run site security and that sort of thing. So for the most part, we are just waiting on the supply. And once we have the supply, we can scale up as necessary to vaccinate as many people as we need to.
That's really exciting. I have just one follow-up question though, and that it kind of relates directly to my friends Frank and Mary, who only have many of whom have only the vaguest of notions of how to get onto their own laptop, if they've got a laptop. And so the question is, I assume that a piece of this must be some kind of outreach to those senior populations who really aren't connected. So how do you deal with them? How do you deal with the kind of the homebound, the folks who kind of aren't connected to this stuff? Although in Nantucket, because it's such a tightly knit community, I'm just always amazed by how tightly knit this place is. There aren't going to be that many, I don't think, because everybody seems to know everybody. But that said, how are you dealing with those folks who will tend to be older and shut in and non-tech savvy?
So the first step in dealing with people who can't do the conventional connection method is that we have very tight relationships with existing senior services and senior programs. For example, the salt marsh, et cetera, et cetera. So we're using their communications channels. We're using a lot of word of mouth. The salt marsh will be involved in the administrative side of the vaccination program to a degree. And they're reaching out, and depending upon the numbers of people who are having trouble accessing the web sign up, we have plans in place to collect information on printed out forms and then have them processed, and entered into the database so that we can analyze it. Please go ahead.
So I've heard that people are trying to sign up at the doctor's office. Who is the one who certifies the comorbidities, or can how do you get that arranged to the satisfaction of the people giving the vaccines?
Well, so obviously we want to get as many people vaccinated in as short a period of time as possible. So on the form, we're using a self-certification program. So you certify that you have X and Y. And there's been some state and well, multiple states, in fact, have actually added sort of executive orders to make sure that the vaccine is going to along the priorities that you are. So essentially, when you sign up on this form, you're certifying that under penalty of law, you have X, Y, and Z. But you know, the more vaccine we get out, the quicker, the better it is in terms of the epidemiology of the situation. So you know, we're not going to be, you know, checking,
calling the doctors and saying, "Oh, does this person have?" Yeah.
You know, the date of birth thing is one of the major qualifiers for the earlier stages of the process. I mean, honestly, a significant portion of the island qualifies for phase 2. So we're going to err on the side of inclusivity as opposed to exclusivity. That said, there are criminal and civil penalties for lying on these forms. So, you know, don't, please.
Even though you're 64 and you really wish you were 65 right now, you know, for the very first time, you actually wish you were older. You know, it's an amazing thing.
And so once you're vaccinated, can you still pass the disease along asymptomatically? I mean, how, you know, when do you think the salt marsh is going to reopen?
See, I am unwilling.
I know
to
that's
give,
yeah.
I'm unwilling to give any kind of timeline on that. From what I've seen in terms of various studies on this, we need to have about 80% of the population vaccinated to kind of get that sort of level of immunity that we need to prevent transmission. And because the vaccine is so new and because of the uncertainty surrounding the vaccine, in terms of like the length of trials, we actually are not sure right now if the vaccine prevents you from being a carrier. So when you get your vaccine, it's not party time. The vaccine is, when enough people are vaccinated, then it's party time. Then we can go into the salt marsh, et cetera, et cetera. But that timeline is looking to be, you know, end of phase 3. If you remember the graphic, that's looking at like end of spring, beginning of summer at the earliest. You know, 80% of 300 million people must be vaccinated before it's over. So light is at the end of the tunnel, but there's still a ways to go before we're there. And one of the reasons they're doing these phases is to have time to do the research to know exactly what is going to happen when the vaccine and the COVID start to interact. As a result of the early vaccination processes, there are trials underway to determine if you're still contagious, and you know, that kind of there's no alternative but to just take time and do the science on that one. We do know that the vaccine is 99 to 98% effective at reducing severity of symptoms in the people that have it. We know that it's a very new, very modern application of a research project that doesn't use the virus in the vaccine. Traditional vaccines are, you know, you in one way or another, you neuter a virus and then you expose the body to that neutered virus to provoke your body into learning the proper immune response to that virus. This is not that type of vaccine. This is a completely, the result of about a decade worth of research in other vaccines for H1N1, for a variety of other different diseases. But this particular method is new. So while we know that it's very effective, we know that there's zero risk of giving someone COVID from the vaccine, as much earlier vaccination programs had a minor risk of that. This one, there's no chance of that, but we don't quite know how it interacts with contagiousness. Your body immediately knows how to respond to a COVID infection once you're vaccinated, but whether or not there's enough replicating particles in your body to be infectious is something that is still being determined. So you're still going to need a mask, much like the mask. The mask is not there to protect you. The mask is there to protect other people. once you're vaccinated, you will be protected, but you could still potentially be dangerous to other people, which is why they did the prioritization process they did.
And so another question about, so once you get the first dose and then the second dose of the vaccine, are you going to get like a sticker on your license, you know, or how will you be then identified as somebody who has been vaccinated, and will that affect your ability to travel, you know, in state, out of state? You know, how does that deal with the travel restrictions?
I have heard nothing about your vaccination status impacting any of the COVID-related travel measures or so on and so forth. Again, because you might be contagious, because the data is still out on that one. If you went and traveled somewhere and you picked up COVID, even if you're vaccinated, you're not going to be ill, but you could still be a carrier.
Right.
So I would not expect the travel restrictions or any of those things to be lowered purely because of vaccination rates until we hit that magical approximately 80% number.
And so if you're planning to be in another state, if you, for instance, travel to Florida for, you know, the winter or for several months, and you're a resident of Nantucket and you don't get your vaccination before you leave, what is your course of action when you arrive where you're going?
So because the vaccine is being administered on a state-by-state level, the planning portion of the vaccination process, who's covered, how it's administered, the inventory tracking, determining whether you're vaccinated or not vaccinated, that varies from state to state. So in a hypothetical other state example, I can tell you absolutely nothing about what would happen in another state. You might have a completely separate sign-up system. You also need those 2 doses within 20 or so days. If you get one somewhere, you absolutely cannot get the other one somewhere else. Like the best bet is to not travel really until travel restrictions are reduced. Then the second best bet is to not travel until you're vaccinated. And then the third bet, which is not best, it's bad, is to kind of wing it on that front. It is a major public health issue that I think people need to be mindful of, and mobilizing this quickly to do as massive an undertaking as vaccinating an entire country in short order, it's very chaotic. It's constantly evolving. Every day we're getting new guidance and new updates, and our job is to try and give you as clear and precise a picture of the current situation is. But I do not, for example, have access to any of the guidance that they have in, I don't have any of the guidance that Florida is giving to their public health departments, for example. And we do not, everyone in public health is dealing with the problems in front of them. And we do have some forward-thinking people who are working on that, but it's best to stay in your state until vaccination is heavily underway.
Jericho, as I mentioned at the beginning of the show, one of my jobs is to be the kind of informal timekeeper, and I'm looking at this, and of course these are fascinating and really important things. But I think we're running close on time, so I think but I have a strange feeling that we're going to be, I'm going to be relying on my co-host to invite you back. And to the extent when you're thinking about it, as you're working with any of the officials, to the extent that you think that this show can be useful in terms of helping to transmit this message to as many people as possible, especially those who aren't necessarily that tech savvy, but know how to use the clicker on their TV. Obviously, we'll do anything you want us to do, right?
I mean, one of the really big struggles right now is making sure that we keep people appraised on the current state of the vaccination system. And I will be absolutely very happy to do, semi-regular updates where I can find a way to keep this information in front of people. The town's going to be deploying a variety of different methods. We're going to have a COVID hotline, or a vaccine hotline that you can call in to get the vaccine report for that period of time.
That's a good idea.
Yeah,
and is there a number that people could call if they're watching this show, and they're not necessarily, they can't click onto someplace? Is there a number that they can call to just talk about this and to talk about how they're going to sign up or whatever?
Unfortunately, the health department is 5 people, so the volume of calls will very quickly, exceed our ability to handle it. The hotline number that we're setting up now, we're literally just waiting for the security vendor to get it properly authorized and secure, and then we're going to be sharing that. For example, probably if it's ready in time, we're going to share it tonight at the select board meeting. I'm going to have town social media send it out. It's going to be going in the Salt Marsh newsletter, everywhere I can get that number in front of people. And when/if you guys want me back again, I would be very happy to share it on that front.
Well, Arthur, Arthur, I think I've got an in with getting Jericho back on the show, because we've gone through the whole show without mentioning that he's my son.
Oh, I thought you were trying to hide this from the rest of them. I wasn't going to try to bring it up,
I just didn't want to embarrass him at the beginning of the show. Not that not embarrassment, but
no, definitely not.
I know, but I'm really proud of how he stepped in and really handled the situation.
Well, let's give it a few more months before we call it handled, shall we?
Well, handling. Let's just say.
Okay, I'll take
the
present progressive.
Yeah, because
but Jericho, I think certainly your experience as a teacher, your ability to communicate is wonderful, and so I think we've really appreciated this kind of concise, for people who are just nervous about this and get overwhelmed by the information. I think this has just been provided some really, really helpful information. So I guarantee we'll be seeing more of you, as long as we can keep you in good relations with my co-host. So thank you very much for doing that. Allison, this was great of you to be able to lure him to come on. I know that he's buried in his day job right now, but I think this is really helping a lot of really, really vulnerable people.
Yeah, Jericho, thank you very much.
It's my pleasure. This is literally my job, and if I can make people feel a little bit more secure and understand the situation better, then I am very happy on that front.
And speaking as a 70-year-old, I really appreciate the information. So thank you very much, Jericho, for coming on. Allison, thanks a million for doing this, right? And thanks to the folks at NCTV for, being able to work with us and Dee. And folks, we hope you enjoy this information, that you've benefited from this information. We will do everything we can to keep you in touch with this. This is going to be an important several months. We're almost out of this. Just stay safe. As Jericho was saying, just stay safe. And we'll see you on the next installment of Frank and Mary here on Nantucket. Thank you.